Okay, so you have a map for where you're traveling this holiday season, but do you have a map for the hot zones of community spread for 3 viruses that may also be at your holiday gatherings? We're going to break it down for you on today's morning medical update so you can protect yourself from the respiratory illnesses hitting communities the hardest. And yes, COVID is still with us, but RSV and the flu are coming on strong. These are serious viruses as well. In fact, the flu alone has claimed 7 pediatric patients so far. 7 pediatric patients have died from the flu so far. Plus, as you get set to prepare that Thanksgiving meal, a warning about a trendy but potentially disastrous way to cook your turkey. Good morning. It's Tuesday, November 22nd. I'm Alexis Del Cid in for Jessica Lovell. Welcome to the Morning Medical Update. And we are live in the Dolph C. Simons Jr. Family Broadcast Studio. And if you feel like everyone you know is getting sick with one thing or another, you're not alone. The flu, RSV, and COVID are all here at once. So we want to give you a look at the risk of community spread this morning, how to keep you and your loved ones healthy over the holidays. Also, send us your questions. You can send them in right now to YouTube, Facebook, and the Medical News Network. You can find links to those and that email right there on your screen. And this marks the 3rd Thanksgiving since the start of the COVID-19 pandemic. And this time around, we do have better tools to manage our risks, including vaccines, of course. While COVID remains a threat, it is not the biggest threat to your health right now. We want to bring in our experts to explain. We have Dr. Marc Johnson joining us, the lead researcher of Missouri's Sewershed Surveillance Project. We also have Dr. Amber Schmidtke. Dr. Schmidtke is the chair of the Division of Natural Sciences and Mathematics at the University of St. Mary. And Dr. Schmidtke, right out of the gate, we're also going to get to Dr. Barr, who joins us with the latest COVID numbers. But Dr. Schmidtke, right out of the gate, I got to ask you about the 7 pediatric cases. Where did those happen? Where are those deaths happening?
Well, we don't know exactly yet. When the numbers are small like they are right now, the CDC usually kind of keeps those details a little bit private, because then you could Google search a death in Indiana, for example, and find out who that was. And so later on in the season, we should expect to see a more robust map that shows where those deaths are taking place. But it's been within the last 4 weeks.
So when we say 7 pediatric patients have died, we're not talking about necessarily even locally in Kansas or Missouri. This could be anywhere in America.
That's right.
We haven't narrowed that down yet. Well, we know that, Dr. Schmidtke, you've brought us so much good data. We want to look at the community spread of the flu right now, and I want you to walk us through your data.
Sure. So let's see what we've got here. So this is a map that the CDC produces. It's called their Flu View Report. And what it does is it ranks influenza-like illness, because kind of like everything tastes like chicken, everything looks like flu. And so there's a lot of things that share a lot of similarity. And so rather than knowing exactly how many flu cases there are, because not everybody's going to get a test, we track influenza-like illness instead. And so this graph, or rather this map, is showing you how intense is that demand on outpatient health care. So that could be anything leading up to admission in a hospital. And in fact, this year, the intensity is so high, especially in the South, that the CDC had to add a new color to the very high category.
No.
That deep purple color is new. So yeah, it's high. And in fact, Kansas is in the high category right now, and our neighbor Missouri is in the moderate category, but right at the top of that.
I would expect, and tell me if I'm mistaken here, but I was expecting the northern states to be darker because it's colder and everyone's always sniffling up in Kansas and above. Why are we seeing it so dark in the southern states?
It's a good question.
Is that unusual?
Yeah, typically I agree with you. We would tend to expect to see some of that respiratory illness more where it's cold and people are having to gather indoors. But the South is where it's at right at the moment.
I want to bring in Dr. Johnson because Dr. Johnson has some really unique insight on this. Dr. Johnson, do you track the flu with the Sewershed Project or just COVID?
Just COVID for now. We're working on the flu, but we're not. We want to make very sure that we're confident in the information we're conveying before we make it live, but we are working on that.
And then what's that?
Go ahead. There are some places where they're doing flu, and it will, I think, be a tool sometime in the near future.
So the Sewershed Project is just what it sounds. You're tracking wastewater or the sewer water to track the variants. Can you track specific variants with that water?
Yes, very, very effectively.
And how are you able to do that? Like, how does it work for people who aren't familiar with that? Because you don't normally associate sewer with COVID.
Yes. It's pretty amazing. So people who get infected with COVID shed a certain amount of the viral material in their feces. And we collect about a quarter cup of a composite sample from each sewer shed, and we can pull the RNA out of there, which is the genome of the virus, and sequence it. And each of the variants has a slightly different sequence. And so we can tell from that information which of the lineages are circulating in each sewer shed. It's been really like with Delta, this was really amazing because we could see it moving through the state. And every time it appeared in a sewer shed, we could see, okay, it's there.
Wow.
And you could just set an egg timer. Within 2 weeks, there would be a huge spike in the RNA numbers and the number of cases. So that actually lets us to sort of see on a Missouri level, too, when there's a new variant, whether it's going to be a cause for concern or not, because we can see when it arrives in an individual sewer shed, and then we can watch for the next week or two after that and see what happens. And fortunately, although we're getting a lot of new variants in, none of them are doing what Delta did or what Omicron did. Yeah, so you can look on the map that it's in the Kansas. So there's two main sort of flavors of the new lineages that are coming in. One is called XBB, and the other one's called BQ11. And they've both moved into the state, but they moved in from sort of different directions. So Kansas City area, you'll notice almost every one of them has actually that might be the exception. Most of the Kansas City area had XBB first, and BQ11 was more on the St. Louis side, but they're both now mixing very well. So it's actually interesting for us to watch because we can see where they're both in the same sewer shed, which one is going to win.
So what does this mean for people watching at home right now, looking at that map? If they go and Google the Sewershed Surveillance Project, the website pops right up. How do you read that map from your own specific neighborhood?
So the map you're showing there is the variant map. So this one, you can look and you can tell what variant is circulating in your area. And this is actually very relevant for some kind of medical applications. For instance, some of these lineages are completely resistant to all of the monoclonal antibody therapies. So if you're a person that needs those, then you know once a certain variant is around that those aren't going to work anymore, that you have to use other types of precautions or interventions.
Dr. Schmidtke, I'm sorry, there's a bit of a delay, so sometimes we tend to talk over each other. What were you going to say, Doctor?
I think there's another map you'll show, which is the total numbers of SARS-CoV-2. And the good news is, despite the fact that XBB and BQ11 are now throughout the state, neither one is causing increases. The state is cumulatively are essentially at all-time lows since we started the project. Now, that being said, I do want to put in the caveat that last year and the year before, it was right about now where we started to see lineages. We started to see the numbers go up, even though there was no new lineage. So around Thanksgiving last year, if you'll recall, is right about when Delta was having a second wave, which was then followed by the Omicron wave. So it was a rough winter last year. But a lot of these viruses are seasonal, so there's a good chance that we will see increases just because people are inside a lot more and interacting in locations where spread is more likely.
I want to bring in Dr. Schmidtke now to talk about COVID variants and RSV, which rounds out our trifecta of respiratory illnesses that are included in the community spread. How do you interpret that, and what are you seeing?
So like Dr. Johnson was saying, COVID is at a pretty low place right now. I think it's higher than any of us ever wanted it to be in terms of when the pandemic first started. But it's at a manageable level right now. And in fact, it's not really the thing that we're terribly worried about at this moment. But like Dr. Johnson was saying, I think we can expect that there will probably be some sort of a rise over the winter months because that's just how COVID has behaved over the last 2 years. Mm-hmm. And as we continue to gather for Thanksgiving and Christmas and all of the winter holidays, those are just new opportunities for the virus to move. And what Dr. Johnson is able to show is that the virus is still evolving. And so we never know which variant is going to become a real issue or which ones are going to be sort of interesting, but they don't really lead to a spike in illness. So we'll just have to see.
When we're talking about the flu, I just want to go back to something you said, is that the image we showed was flu-like, right? So how can you tell when we're talking about outpatients and patients who aren't hospitalized and things, they're just feeling miserable? I know we've got outpatient influenza data that we're pulling up. How can you tell if it's outpatient that it was the flu and that it wasn't, and what are we seeing here?
So on this graph, what we're looking at is the percent of outpatient visits that are there for influenza-like illness. And what you can see so far is that flu is here, it is early, and it is already higher than we have seen for some of the past 5 seasons. When it comes to influenza-like illness, if you've ever gone to the doctor and you're talking about a viral infection, oftentimes they won't test, and because there's not a lot of treatments that we have available for a lot of upper respiratory infections as it is. But they do have rapid flu tests they can do, and that can be important, especially if you're a person who's at risk from complications when it comes to influenza, because there are antivirals. But as I'm sure we're going to hear about later, this is something that you really have to get on board right away in order for it to have its maximal effect.
Dr. Schmidtke, I know you're not going to toot your own horn, so we're going to toot it for you. She has this incredible website and newsletter, and it's been used as a guide by so many medical professionals across the country, really. So if you want to receive the newsletter that Dr. Schmidtke puts out, you just need to Google the COVID Digest with Amber Schmidtke. It's SCHMIDTKE, Amber Schmidtke, and you can sign up for that newsletter, and it's super helpful. I want to talk about preventing getting sick, right? We know to wear masks on planes if you want to be super careful. Some people are done wearing masks now. Wash your hands, stay home when you're sick. Is there anything else people can do to protect themselves?
Well, you know, one big thing I would suggest is go get your flu shot and go get your COVID vaccine too. So if you haven't received a COVID booster within the last 2 months, you are most likely eligible for that booster dose at this time. And you can actually get this at the same time as your influenza vaccine, perhaps even in the same arm if you're a person that sleeps on your left side or something like that. So the important thing is it's not too late to get those things so that you're ready. Of course, they're only going to protect you against those specific threats, and we know that there's a lot of different viruses that can hit us in the wintertime. So I think it's important to dig back into that toolbox of things that we've learned through the COVID pandemic that were, you know, not medical. They were things like boosting ventilation indoors, frequently washing your hands, as you mentioned, and staying home when you're sick. You know, I think that, you know, that was a good thing that happened during the pandemic, and as we're emerging from that acute phase of the pandemic, I am seeing a lot more people show up at work or show up at different places sick, and I'm like, ooh, I really wish you wouldn't. So.
Right, we used to work through colds.
Yeah.
You just show up when you were sniffly. Then it went to the opposite end of the spectrum, where if you had just a tickle in your throat, your boss is telling you to stay home. Do you feel like, and have you seen data that supports that we had less RSV and less flu cases because we were all wearing masks for so long?
Oh, absolutely. I mean, the data is out there, or the data are out there rather, that do show that we did see, like the first year of the pandemic, we virtually had no flu that following season because we were all wearing masks. We were careful about staying home. Some locations were under, you know, schools weren't in session, so that was cutting off an opportunity for virus to spread. So we have it within us to knock these things down. It's just sort of a balance of how much are we willing to give up in order to achieve that goal. And so I think what we've seen in society is we're not willing to give up quite so much for that. As long as we can keep it manageable, I think that that may be the best that we can hope for.
We have a QR code that we can put up on our screen right now for everyone watching. This will be very helpful for you to get you through the next 16 weeks. You think we got 16 weeks of winter, guys? It feels like there's a good 16-week stretch where everybody's sick all the time. But the QR code is great. It will take you to the latest COVID information. It will also help you find a COVID testing site near you if you have to drive somewhere or look for it. So that's very helpful. We have Dr. Nathan Barr here right now. He's in for Dr. Hawkinson. Dr. Barr, you have the nitty-gritty on the COVID count.
Yeah, I do. So actually, you know, it's not so bad in the hospital comparatively. So 21 active cases, but none of them in the ICU, which is a great thing to see. That, you know, the ICU number always is a good indicator of just how sick folks are. And obviously, we don't want anybody to have to be hospitalized, but not being in the ICU is a good
great.
thing. Another 18 folks that are still recovering. So we still have actually a fair bit of numbers, but at least not requiring ICU care.
We have 2 zeros on that graph, which is
cool
awesome to see. Dr. Barr, we know people can get COVID more than once, even if they're vaccinated and boosted. Guilty. That was brutal. But there is a new study. This is even worse. It shows that repeat COVID infections increase your risk of organ failure, which is not what anyone who's gotten COVID more than once wants to hear. Dr. Barr, are all of us at risk for organ failure if we've gotten COVID more than once?
I mean, I guess the first thing I would just say is the term organ failure is a little terrifying. So I would maybe say we could talk about it a little different way, just because I think I don't want to just terrify everyone to start the morning. Although there have been times when I've been on the show and I've totally been down with trying to terrify people in the morning and scare them.
So what do they mean when they say you're at risk for organ failure if you have repeat infections?
I would just say, think about it in terms of even non-infectious illnesses, right? So like if you are a football player and you keep getting hit in the same spot and they're pretty big hits, then maybe you break a bone eventually. If you get a respiratory illness over and over, that can potentially scar your lungs to some degree, right? And so if that happens over and over, that's not a good thing. And so the more times it happens, the more risk you are for losing function, things like that. So I would just think of it that way. But it's another good reference point to say, we don't want to get more COVID. So when we're weighing like, oh yeah, we're heading into the winter, we're worried about cases rising in the future, all that sort of thing, that's a good reason to pull out these tools, right? It's a good reason to be vaccinated so that maybe it doesn't hit you as hard. I would say, yeah, this happens in this study in vaccinated and not, but of course your damage you can get from the COVID is going to be a lot worse if you're not vaccinated, right? So also masking, right? So this is a great reason to say, okay, bring your mask. If you're going into a small enclosed area, you should have a mask on. I've been doing that the whole time. I know a lot of the country has said that they've had enough of that, but that's an easy tool. It's just not as hard. My 5-year-old, in fact, had a respiratory illness recently and was wanting to wear a mask around the neighborhood because she just wanted to protect her neighbors.
Oh, that's sweet.
So she can handle that, and so can we all.
It's the daughter of a doctor right there.
Right.
That's sweet. I want to ask you about an international study that found that, this is good news, that flu shots can save the lives of people with cardiovascular disease. Yeah. How?
Yeah, so we know that similar to COVID, one of the complications with influenza is that you can have bad heart disease, you can have cardiac infarctions or heart attacks, amongst other things. And so, it's essentially pointing to that sort of thing, right? If you have your influenza vaccination, you're less likely to get those sort of events. So, it's the same points over and over about vaccinations, and it's different degrees for all of these, but, they generally, they're helping prevent the most severe outcomes, and so that's one of them with influenza.
We're getting some very good community questions. First, I want to ask if we have any reporters on the line today. Okay, let's get to our community questions. Want to start out with Sharon Chapman Whitlaw, who wants to know if there is a test that will test for all of these at once. I assume Sharon's talking about COVID, RSV, and the flu. Is there,
yeah, there
Dr.
is.
Barr?
And a lot of health systems have this, so there's a PCR test that can test for all three at once. And so, yeah, that's something we can absolutely do.
A single test?
A single test can test for all three at once, one swab, so not 3 separate swabs or anything like that. So it's one test we can do. A lot of health systems have the ability to do that.
Joellen McGranahan has a question for Dr. Johnson. Please define sewershed.
It's like a watershed, but for sewage. So every toilet that contributes to a wastewater treatment plant, all of those toilets define the sewer shed. So there's about a dozen sewer sheds in the Kansas City area.
And is there a specific way you have to collect that data? I mean, is it like a bunch of people all suited up with a specific cup or I don't want to get too graphic in the morning, but how do you do that? It's so interesting.
There's a machine that has a tube that goes down into the influent, and it sucks up a little bit of the wastewater every half an hour for a 24-hour period, and that gets mixed together. And then it's our collaborators at the wastewater treatment facilities that take small samples of those, put it into a sample tube, and they use the state courier system to deliver it to our lab. So we get pretty rapid turnaround of the numbers for them.
Lauren has a question for you. I'm going to keep you on this topic. Lauren wants to know, if it rains a lot, does that mess up the data?
It did, but this is a fun one. Can I play 20 questions with you? What's the one thing you can measure in sewer shed water to determine how much human contribution there is? There's something we use that you've probably all consumed this morning that we can measure, which can tell us if the wastewater got diluted.
Coffee?
Yes, caffeine.
Oh, really?
Yeah,
okay.
We measure the amount of, so with all the sewer sheds now, we measure all of the caffeine, and we can tell by the caffeine concentration whether the wastewater, how much the wastewater has been diluted. So if there's a heavy rain or something, then our first reliance is if the sewer shed operators can tell us the actual flow rate, how much wastewater passed through their facility in the last 24 hours. But if they're unable to share that, sometimes if it overflows, they don't know, or they might be late getting the numbers into us. So then we measure the caffeine, and we use that to tell whether the wastewater has been diluted or not.
Okay, I've got just a random question here. So after a huge win like the Chiefs had on Sunday, would you see a lot of caffeine on Monday morning? Do you see that?
Probably could. There are variations from sewer shed to sewer shed in terms of the amount of coffee, and it.
Okay.
I shouldn't get into the details, but if I told you, it would make sense. Like, oh yeah, you would drink a lot of coffee there.
Oh, interesting. Oh, that's cool. Okay. So do all states, again, we've got a lot of questions coming in for you on this. It's not just me. Patty wants to know, do all states track wastewater?
Some more than others. I have to say Missouri has one of the most comprehensive setups.
Interesting.
We got on really early in this partnership between the University of Missouri and the state DNR and DHSS. So we're pretty advanced. We're covering over 60% of the population. And the only reason it's not 100% is because we have a lot of people who live in the country, and I'm not going door to door to collect from their septic systems. But most states have some. There is a CDC dashboard that tries to keep track of them all. It's called News NWSS. If you Googled NWSS and CDC, you could find that map. But they aren't all quite as advanced as Missouri's.
Janet Coy has a question for Dr. Schmidtke. Janet writes, would you please ask Dr. Schmidtke about the masks she recommended on a previous program a while back? You'll have to refresh my memory on that too.
Sure. I think the point is, if you're going to wear a mask, let's wear a high quality mask, right? And so we don't, as pretty or as fun as those cloth masks are, they're certainly better than nothing, but they're not as protective as you might think. And so what we are recommending a lot lately, something that's easily accessible for the public, are those KN95 masks or an N95 mask. These are going to have better filtration capability and better protect you from COVID as well as other respiratory pathogens. The key here is to find one that fits your face really well, because if it's leaking, then it's not protecting you as much as you think you are, and then you're walking around thinking you're invincible when you might not be. So I really like
the two kinds again that you just said.
So there's the N95 and then there's the KN95.
KN95.
The N95s tend to be the sort that have a strap that goes around the back of your head. The KN95s tend to have the ear loops.
I like the ear loops better.
So yeah, it's a matter of personal preference. The N95s tend to be really, really good. But it depends on what you're using it for.
Joellen McGranahan has a question for Dr. Barr. What are the effects of flu on people with high blood pressure?
Well, the high blood pressure itself doesn't worry me as much. It's more, is it under control, right? And so if your high blood pressure is really out of control, then yeah, you could, see problems if you get flu on top of that, strokes and heart attacks and things like that. But the main thing is, as long as you have your blood pressure being well controlled with your doctor, then that's, that itself is not a huge risk to me.
John has a question for Dr. Johnson. John wants to know, Dr. Johnson, can you tell where in the community that the cases are coming from, down to the neighborhood or street?
Theoretically, yes. We don't do that routinely, but it is possible. We have a study we worked on, not in Missouri, but in Wisconsin, where there was a really weird lineage that was coming in their sewer shed that wasn't any of the circulating lineages. It was something completely different. and we tracked it manhole by manhole all the way down to the toilets that it was coming from.
You're kidding.
At the time, we thought it might be coming from an animal reservoir or something. It was totally different. And what it turned out is it appears that it was a very, very long-term COVID patient, someone who probably has had it for a year and a half, and they were shedding just tons of virus in their stool. And so, if you really want to know, you can go down to granular level, but that's not generally the philosophy of wastewater. We want to be anonymous, de-identified. We don't want to know about individuals. We want to know about populations.
So how rare is it, Dr. Barr or Dr. Schmidtke, to have someone have COVID and be shedding it for more than a year? I'll start with Dr. Barr.
Yeah, I mean, it's not common. These are very rare, and it's really people that have quite suppressed immune systems where this is happening. And so, they're getting treatments. We're trying to help them clear it, but their body doesn't have much of an immune response. So, one thing that I always think about is when we talk about, masking and all these things, those are the kinds of people that really need our help and need the rest of the community to help protect them.
And are they still contagious that whole time if they're shedding?
Yep.
So you can be contagious for more than a year?
Yep. So there are some rare cases where folks can be. That's not a common situation at all, but that can happen.
One more question. This is from Taryn. Taryn writes, it seems like less people are willing to test for COVID. Are you seeing a big difference in data from positive test results versus what's showing in the wastewater? I'm going to start with Dr. Johnson on this one, but then I would love our other panel's thoughts on this. Dr. Johnson, are you seeing a difference?
Repeat the question?
Are you seeing a difference in data from positive test results versus what is showing in the wastewater? Because fewer people are testing.
We know that fewer people are testing, but it's impossible to know whether you don't know how much of it is because people aren't testing, and you don't know versus difference in the amount that they're shedding. It seems that the amount that's shed per infection on average is going down, which makes sense because as people are vaccinated one way or the other, they tend to have shorter courses of infection. But it's generally believed now that wastewater is sort of the more unbiased readout because it's really hard to get a handle on how many people are not testing at all or testing at home and not reporting it.
Dr. Schmidtke, as we go into our final thoughts, I would love your take on what Dr. Johnson is saying and how this information helps you help us with your blog and your newsletter and all the information that you're able to share.
Absolutely. I mean, I'm a big fangirl of what Dr. Johnson's been doing, and I've been a follower of the Sewershed Project from, I think, the beginning. And I use it in the blog routinely to see what's going on because, like he said, this is the canary. This is the proxy indicator that we can see through the fog of incomplete data, right, of what's being tested in the community. And COVID, this isn't new for COVID, right? We have a lot of diseases that we're probably always underestimating because it causes a wide spectrum of illness ranging from the common cold to something really severe. And so a lot of people don't ever seek a test for flu or for RSV or for other infections. And so we're always kind of trying to better estimate how many people are truly impacted by some of these diseases. So I'm not surprised, but it's really great to have a tool like the Sewershed surveillance data. And I'm really excited to hear that we might be getting that information for flu and for some of the other really common respiratory infections in the months, years, whatever to come.
Dr. Johnson, I bet this is the first time you've been on one of our programs and had someone say they were a fangirl and have it be this accomplished doctor that we all follow. That's a pretty good compliment. It's is fascinating. Gratifying. What would you like our viewers to know?
Don't be freaked out every time you hear about a new variant. They aren't always going to cause a surge in cases, but just be aware the virus is still here. And we've got lots of them that are here now. So especially if you're in a class where you are threatened by these, you take precautions. There are things you can do to keep yourself safe.
Dr. Barr?
Well, so let me just say I'll apologize if I'm repeating. I just missed what Dr. Johnson was saying, so hopefully I'm not. But I would just want to say, one, it's a really great time to pull your mask back out if you've put them away. And then secondly, we mentioned, I think it was Dr. Johnson earlier that mentioned briefly, some of these our only monoclonal antibody treatment and our monoclonal antibody prevention tool are very likely to not be options in the near future. So if you're sort of, going around with that in the back of your mind, well, oh, I got monoclonal antibodies, I'll be all good. I just exercise a little caution because these viruses are adapting and we're going to lose some of those tools.
That's all very good information. We also have a reminder for everybody, if you start prepping your Thanksgiving right now, be careful. The University of Kansas Health System Burn Center advises against deep frying your turkey in oil. Yes, it will taste delicious. However, if something goes wrong, you are at a risk of getting badly burned. Doctors see it every year. In fact, the Burn Center recommends just stick to the oven. The National Fire Prevention Association says on average, accidents while deep frying a turkey will cause 5 deaths and 60 injuries every year, and those are just the injuries that are reported. Some other advice: stay in the kitchen when you're cooking things. Don't just set it and forget it. You can monitor your food while you're cooking it, unless it's that turkey you have to roast for 5 hours, but then don't leave the house and leave it there alone. Also, keep children and pets away from the stovetop or the counters and tabletops that have hot food. That's always a risk for causing an accident. And make sure all your smoke alarms work. That is also key. Hope you don't set your smoke alarms off while you're cooking, but it happens. Always better to have one than to not have one. Thank you so much for being with us today, and thank you to our doctors for taking the time out of their busy schedules. You can catch our updates anytime by logging on to Facebook, YouTube, and Twitter. We will see you back here tomorrow morning at 8 a.m.
It can be tough to read lips behind a face mask. The demand for hearing aids has gone up due to the COVID pandemic, just as the FDA approves over-the-counter sales. I'm Jessica Lovell. So how do you know what to buy? And are all hearing aids created equal? When should you ask an expert? The answers on the next Open Mics with Dr. Stites, Wednesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.